Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual. And today we have some more important rules in the clinical care tips category about you, the provider. Rule number 94. Give yourself the credit for what you did. So this rule has to do with your documentation, with your work, with really giving yourself credit. A great example for this rule that sometimes surprises my residents that I say it is when I see a patient with a foreign body. Let's say a 4-year-old toddler that puts a bead in his ear. Very common. I do whatever I can, get it out, clean the ears, make sure there's no bleeding, etc. And in the end of the procedure, I always make sure to tell the mom or the dad, Mom and Dad, if your child is one of those kids who does this, meaning puts foreign bodies in his ear, in his nose, etc., please make sure he never has access to button batteries. Beads in the ear, food in the ear, no big deal. But if your son ever puts a button battery in his ear, that can be a surgical problem and a very serious emergency. So please make sure your son does not have access to button batteries anywhere. Don't have them at home. I then continue to document that exact discussion. So documenting something like discuss with mom and dad that if the patient ever puts button batteries in his ear, those can represent a surgical emergency and should be avoided, etc., etc., etc. If I took the time to make sure parents are aware of the danger of button batteries in the ear, in the nose, etc., I should document that I did that. I should give myself the credit for the work/anticipatory guidance I gave. This is no different than documenting a procedure you do. Whether it's a simple nursemaid's elbow, suturing, you always document what you did. Some of it has to do with billing, which is very important, so we get paid for what we do, but it also is the right thing to do for your patient, so if the patient comes back to the ER, everybody knows what happened. If the sutures have to be removed, the doctor who removes them knows to expect 3 or 4 or 5 sutures, etc. And again, it's just good medicine. Document everything you did, document everything you said, and give yourself the credit for what you did. If you went out of your way to give good anticipatory guidance, give yourself the credit. Just in case the patient comes back, mom cannot say, oh, I wasn't aware about the potential problem that can happen. Well, this was discussed with you, mom, as noted in the pediatrician note from before. And I can think of more examples for this rule. Most of them have to do with anticipatory guidance. So another example, when I examine a baby and I do the abdominal exam and I notice an umbilical hernia. Most of the time the parents are already aware of it and they know it may get bigger, but I take the extra minute to explain, Mom and Dad, as you probably know, this hernia may get bigger and it's totally fine as long as it's always soft and you can push it in. That's fine. If you ever notice that it's very firm, very tender, and you can't push it back in, that's a reason to come and see us in the pediatric emergency department. I then proceed to documenting that exact conversation. Oftentimes, when I see a child with URI, I make sure the parents understand that over-the-counter cough and cold medication should not be used in little children, and I always document that I mentioned that to the parents. So documenting something like, I discussed with mom and dad that they should avoid providing over-the-counter cough and cold medications, etc., etc., etc. Another good example is when I diagnose and maybe even treat phimosis or paraphimosis in the pediatric emergency department, I always take the extra minute to explain to the parents that this problem is very unlikely to happen, maybe even impossible, if the patient gets circumcised. Now, I know this is very cultural, etc., but I just want you to know, mom and dad, that if your little boy gets circumcised, he is very unlikely to have any of those issues. And then again, I document, discuss with mom and dad that phimosis or paraphimosis are very unlikely to happen in a circumcised child and recommended speaking to the primary care about the possibility of circumcision, etc., etc., etc. It is my personal belief that if I took the minute or two to explain to the parents anything about anticipatory guidance, I should get the credit for it. It's something that I think is good for patient care, and honestly, it protects me in case the parents say, oh, I was never told about XYZ. Rule number 95. See the patient, not the waiting room. This rule is actually really hard to apply. And I gotta be honest, sometimes I do forget about it. But I think it's very important that when we treat our patient, we kind of ignore the time limitations or the time constraints we actually have. It's very easy to dismiss some chief complaints when you know your waiting room is busy, full, and just getting fuller. But the reality is that every patient's chief complaint and every patient's parent needs to be addressed in a certain way, regardless to how busy you are and how many patients are waiting in the waiting room. So if you think the patient needs a chest x-ray for the possibility of pneumonia, get a chest x-ray and look for that pneumonia, rule it out. Whether you have 5 patients waiting, 10 patients waiting, and the waiting room is exploding, the patient still needs this x-ray to rule out pneumonia. So keep in mind, your patients have to be treated in a certain fashion, and whether you're busy or not really has nothing to do with anything. So see the patients, not the waiting room. Treat the patient as if he is the only patient you're treating right now. Having said that, I think it's very important to be cognizant of the waiting room and how many patients are waiting. That has to do with efficiency and doing the right thing for your patients. So certainly I take that into consideration, but in terms of the care I provide, the testing I do, the workup I do, the treatment I provide, they all have to do with the patient himself or herself and not necessarily with the people who are waiting. The patient need what they need, and whether I'm busy or not has really nothing to do with it. So remember, rule number 95, see the patients, not the waiting room. Rule number 96, remember, things always take longer than you plan. So this is, I think, a very important rule to keep in mind, mostly with regards to academic work and things you have to do, sometimes in the ER, many times outside of the ER. Again, I'd like to explain by giving one example. So in 2016, I finished my fellowship and started working at the hospital as a PEM attending for the first time. And one of the residents, pediatric resident, who is now a PEM fellow, by the way, approached me that she wanted to do a write-up because she's very interested in pediatric emergency medicine and she wants to publish something to increase her chances of getting a fellowship and have some kind of publication on her fellowship application. I was obviously very happy to help. I have had great mentors helping me over the years, and I was very happy I can be the mentor for someone else. She actually found a very interesting patient we saw together with sialoadenitis, aka salivary gland stones, which is pretty unusual, rewrote it up, and she was ready to submit it for publication. Now, Lindsay was a very hard-working resident, and she got the job done very quickly. I think within a few weeks, she had a case written up, did all the research, etc. This was in her intern year. However, the case did not get published until she was almost finishing her residency and about to go to her PEM fellowship. She is now a PEM fellow in Texas and is going to be an attending next year. The reason for this is because the case had multiple rejections. After several rejections, we finally got a response from one journal. That journal wanted several additions and changes to be made to the manuscript. And it took a long time. Between her schedule, my schedule, it literally took almost 3 years, and this is for a simple case study. You can only assume what happens when you are engaged in a research study or a bigger case or any big project you take over. Things always take longer than you plan. This is a very important rule to keep in mind when you start a commitment of some sorts, again, mainly for academic activities. Keep that rule in mind. You can work hard, you can make a schedule, but unfortunately, sometimes things are just out of your control. So remember rule number 96, things always take longer than you plan. And that is it for today, guys. Thank you very much for listening. I appreciate it. I hope you liked the episode. I hope you check pemrules.com and submit any feedback you have. Let's review what we learned. Rule number 94, give yourself the credit for what you did. Make sure you document well. If you had any session of anticipatory guidance, any procedure you did, give yourself for credit for all the hard work you did. Make sure it's all documented. Rule number 95, see the patients, not the waiting room. It's very hard to do and easier said than done, but treat your patients as if the waiting room is empty and you have all the time in the world. Remember, the patients need what they need, and the fact that you're busy doesn't really change that. Rule number 96, things always take longer than you plan. Be aware, especially with academic work, oftentimes things just don't depend on you and out of your control and oftentimes take longer than you think. Every project you design, make sure you have enough time and take into account many delays that may occur. And that's it for today, guys. Thanks again for listening. I hope you liked the outro. This is my version of Sweet Child of Mine on my bass and regular ukulele.